So let's talk about a couple of key important nutrients that actually change and shift a bit as we get older. So one thing that we need a little bit more of as we get older is fiber. So fiber is something that's very important for us to help prevent the risk of colorectal cancer. Colorectal cancer is still unfortunately a very significant killer of Americans, and one of the biggest problems is that we're not eating enough fiber. We actually showed in our lab a few years ago, we published that Americans are only eating about maybe 14 grams of fiber per day, and the recommendation is somewhere between 30 and 35 grams depending on how old you are and if you're a man or a woman. So again, it shifts a little bit. It gets a little bit more that we need as we get older. So make sure you're eating plenty of fiber. Make sure you're eating lots of fresh fruits and vegetables. Believe it or not, a lot of nuts have fiber as well, and of course your grains as well. So make sure you're eating plenty of those fibrous materials to make sure that you help reduce your risk of colorectal cancer, among other things, as you go through life aging. Now, the second thing that I wanted to mention is protein. Protein also is very important for us as we get older. So as we get older, unfortunately, the stomach stops producing as much hydrochloric acid as it does when we're younger. Well, hydrochloric acid is very important, not just for the breakdown of all food, but particularly for our protein. So as we get older, we probably need a little bit more protein. So make sure that you're getting plenty of protein as you get older to help get and satisfy the protein requirements you need. So two things: make sure that you continue focusing on fiber, and make sure you continue to focus on protein, and to help keep you with a healthy life, to keep you to prevent and reduce the risk of some of these really serious chronic diseases that continue killing Americans.